we're focusing on healthy kids and keeping them healthy, but one thing that we need to focus on is their mental health, because that correlates so much with their physical health. Clint, you're a clinical psychologist for behavior for children here at Budge Clinic. Tell me a little bit about maybe some tips for parents that may have some behavioral issues with their kids.
Yeah, a couple of things that parents should always keep in mind that will help. One is when you're interacting with your children and having some struggles, try to approach the situation in a non-emotional way. Parents will experience emotions, of course.
I know I do.
But
anger is the first one.
Exactly. But the more that you can kind of manage and moderate that and present in a non-emotional way in interacting with the children, the better things will usually go. So that's one thing to keep in mind. Another thing to keep in mind is that the parent-child relationship is really important. It should be a source of strength for the child and a source of positivity in the child's life. And sometimes when there's conflict, that relationship can deteriorate, and that will usually lead to additional problems. So really kind of looking out for that relationship and protecting it, safeguarding it is an important thing for parents to do.
Noticing in different ages of children too, you know, you have your 2-year-olds and that go through their phases, but then you have what are the different stages of behavior that parents might not be aware of but can go, oh, that's normal?
Right. You know, that's a great question. First of all, I might just say that when we talk about working with children, and especially the younger the child is, most of what they're doing is normal.
Yeah.
Developmentally speaking, it's very typical. Now, there's potential for it to go the wrong way, but it's usually fairly typical. So we make a bit of a distinction between kind of everyday behavioral problems, which can be very problematic, but really aren't reflective of a mental health problem, and mental health problems that tend to come along a little bit later in life. And we sometimes think of those behavioral health concerns as precursors for other problems that can emerge if they're not handled carefully or appropriately. So working with parents while children are young and making sure that we're addressing those precursors and really preventing other problems from occurring is an important part of what we do.
So what are some tips that you might give parents that see their children are, okay, that might not be something that's healthy at all as a behavior problem, like maybe playing with fire too much, or they're, acting out because something's not going their way. What would you give a parent as a good source of help for that?
The thing that I almost always say to parents first and foremost is if the parent doesn't feel like they're confident about what they're doing, they're not sure how to handle a situation or a problem, ask for some help, and they can ask their pediatrician. There are other various sources that they could go to and look for help, but asking is the first.
Yeah, that's definitely, because we think, oh, you know what, I'm not one of those parents that needs to ask for help. I can do that myself. But I think almost asking is like saying, I'm a good parent.
Right, absolutely. And there's no perfect child,
no.
and children's behavior often is not reflective of the parents.
That's a big thing.
Yeah.
We think we're bad parents if our kids are bad.
That's right. And then the last thing we want to do is tell the whole world that we're bad by, spreading it around. So you've got to be a little bit careful about that and know that every parent struggles and every parent has questions. Some of the early behaviors that can occur that parents should watch for: non-compliance, when children aren't minding their parents and responding to their instructions. That's typical, but can become problematic if it continues on. Extreme tantrums can be reflective of a problem, and of course, aggression is always a concern. If your child is being very aggressive, you should look for some answers and some support. Also, sometimes mental health can correlate with their physical health. Have you noticed that with children, that when they're physically, there might be something behavioral that's causing more physical problems? Absolutely. Stress comes up, and it's related not only to the behaviors that children engage in, and of course there's stress in families often, but it's also related to a child's well-being and health. And we look for those kinds of situations that may be coming up and causing problems for children or families, and we try to address those because we're not only helping the child behaviorally, but we're also helping them in terms of their overall health. And that's a big part of the reason why here at the Budge Clinic in our pediatric department, we've integrated the behavioral health services that we provide for children and our pediatric services, and we view that as probably the most important thing we could do for the families we work with. I completely agree. So if
somebody needs some more emotional help, they come here for their pediatrics. They can say, I'd like to have my son and child or me go in and see, you as a clinical psychologist. That might be something that they're looking for. Is that possible?
Absolutely. In fact, that's precisely why we've done what we've done and arranged the model the way that we have. In fact, there's data out there from several studies that suggest that when parents come to their well-child care checkups, the thing they most often want to talk about and bring up to their pediatrician are behavioral health concerns.
For sure. Well, thank you so much, Clinfield, here at the Budge Clinic Pediatrics. I appreciate your help.
No problem. Thank you.